Hodgkin lymphoma is a cancer that affects the lymphatic system, a crucial part of the body's immune system. As future doctors, MBBS students must understand this disease. It's essential for diagnosis, treatment, and patient care. This essay will delve into Hodgkin lymphoma, providing a comprehensive overview for aspiring medical professionals. Hodgkin lymphoma is characterized by the presence of abnormal cells called Reed-Sternberg cells. These cells originate from a type of white blood cell called B lymphocytes, which are responsible for producing antibodies and fighting infections. The uncontrolled growth of these abnormal cells disrupts the normal functioning of the lymphatic system, leading to a range of symptoms and complications. The exact causes of Hodgkin lymphoma remain elusive, but several risk factors have been identified. One significant risk factor is infection with the Epstein-Barr virus, the virus that causes infectious mononucleosis. EBV infection is thought to play a role in approximately half of all Hodgkin lymphoma cases. A family history of Hodgkin lymphoma also increases the risk, suggesting a genetic predisposition. Immunosuppression, whether due to HIV infection, organ transplantation, or certain medications, weakens the body's ability to fight off infections and control cell growth, making individuals more susceptible. Hodgkin lymphoma typically manifests as painless swelling of lymph nodes, most commonly in the neck, armpits, or groin. This swelling occurs due to the accumulation of cancerous lymphocytes in the lymph nodes. Patients may also experience a range of systemic symptoms, often referred to as B symptoms. These B symptoms include fever, night sweats, and unexplained weight loss. Other, less common symptoms include fatigue, itching, and pain after consuming alcohol. It is important to note that these symptoms are not exclusive to Hodgkin lymphoma and can be indicative of other conditions. Diagnosing Hodgkin lymphoma involves a combination of clinical examination, imaging tests, and biopsy. This multifaceted approach ensures that every aspect of the disease is thoroughly investigated, leaving no stone unturned. A thorough medical history and physical examination are crucial to assess the patient's symptoms and identify any enlarged lymph nodes. These initial steps provide the foundation for further diagnostic procedures, helping doctors to pinpoint areas of concern. Imaging tests, such as X-rays, Connecticut scans, and PET scans, help visualize the extent of the disease and identify any involvement of other organs. These advanced imaging techniques offer a detailed view of the body's internal structures, revealing the spread and impact of the lymphoma. However, the definitive diagnosis of Hodgkin lymphoma requires a biopsy, typically performed on an affected lymph node. This procedure involves removing a small sample of tissue for further examination. The biopsy sample is examined under a microscope by a pathologist to confirm the presence of Reed-Sternberg cells. These distinctive cells are a hallmark of Hodgkin lymphoma and are essential for an accurate diagnosis. Further tests, such as immunophenotyping and genetic testing, may be performed to determine the specific subtype of Hodgkin lymphoma, which helps guide treatment decisions. These additional tests provide a deeper understanding of the disease, allowing for a more personalized and effective treatment plan. Section 5, Treatment Strategies, a multifaceted approach. This section delves into the various strategies employed in the treatment of Hodgkin lymphoma, highlighting the importance of a comprehensive and personalized approach. The treatment of Hodgkin lymphoma depends on several factors, including the stage of the disease, the patient's overall health, and the presence of any risk factors. Each patient's treatment plan is tailored to their specific needs, ensuring the best possible outcomes. Chemotherapy, often in combination with radiation therapy, is the mainstay of treatment. This combination helps to target and destroy cancer cells more effectively, increasing the chances of remission. The goal of treatment is to achieve complete remission, meaning the disappearance of all signs and symptoms of the disease. Achieving remission can significantly improve the patient's quality of life and long-term prognosis. In early-stage Hodgkin lymphoma, chemotherapy alone or combined with radiation therapy to the affected lymph node regions may be sufficient. This approach aims to eliminate the cancer while minimizing side effects. Advanced stage disease often requires more intensive chemotherapy regimens, sometimes followed by radiation therapy. These aggressive treatments are necessary to combat the widespread nature of the disease and to achieve remission. In cases where standard treatments are unsuccessful or the disease relapses, stem cell transplantation or other novel therapies may be considered. These advanced treatments offer hope for patients who have not responded to conventional therapies, providing new avenues for potential recovery and long-term survival. Section 6. Chemotherapy regimens targeting cancer cells. Chemotherapy is a cornerstone in the fight against cancer, utilizing potent drugs to target and destroy malignant cells. Chemotherapy involves the use of powerful drugs to kill cancer cells or stop their growth. These drugs are meticulously prepared and administered by healthcare professionals to ensure maximum efficacy. The specific chemotherapy regimen used for Hodgkin lymphoma varies depending on the individual patient and the stage of the disease. Oncologists carefully review patient records and collaborate to tailor the most effective treatment plan. One commonly used regimen is known as ABVD, which consists of the drugs adriamycin, bleomycin, vinblastine, and dacarbazine. Each drug in this combination plays a unique role in attacking cancer cells. These drugs work together to target different phases of the cancer cell cycle, increasing the effectiveness of treatment. By disrupting the cell cycle at various points, they help to prevent the cancer from growing and spreading. Chemotherapy is typically administered in cycles, with each cycle followed by a recovery period to allow the body to recuperate. This cyclical approach helps to balance the aggressive treatment with the body's need to heal. Side effects of chemotherapy are common and can include nausea, which can be quite distressing for patients, vomiting, hair loss, fatigue, and an overall feeling of weakness. These side effects can significantly impact a patient's quality of life during treatment and an increased risk of infection. Due to the immune system being compromised, patients must take extra precautions to avoid infections, which can be life-threatening during chemotherapy. Section 7. Radiation therapy, a powerful tool in the arsenal. Radiation therapy uses high-energy rays to damage and kill cancer cells. It is often used in conjunction with chemotherapy to target specific areas of the body where the lymphoma is present. Radiation therapy may be delivered externally, using a machine outside the body, or internally, using radioactive implants placed near the tumor site. Like chemotherapy, radiation therapy can cause side effects which vary depending on the area being treated and the dose of radiation received. Common side effects include skin irritation, fatigue, and loss of appetite. Long-term side effects, such as an increased risk of secondary cancers, are also possible. Section 8. Long-term complications, navigating the aftermath. While most patients with Hodgkin lymphoma achieve long-term remission with appropriate treatment, the disease and its treatment can have lasting impacts on health. Chemotherapy and radiation therapy can damage healthy cells and tissues, leading to complications such as infertility, heart problems, and an increased risk of developing other cancers later in life. Patients treated for Hodgkin lymphoma require regular follow-up care to monitor for signs of recurrence and manage any long-term complications. This follow-up typically involves physical examinations, blood tests, and imaging scans. Patients should also be aware of the potential for psychosocial challenges such as anxiety, depression, and fear of recurrence. Section 9. The importance of follow-up care. Follow-up care after treatment for Hodgkin lymphoma is crucial for several reasons. Firstly, it allows healthcare providers to monitor for any signs of recurrence. Early detection of recurrence is essential for prompt treatment and improved outcomes. Secondly, follow-up care enables the management of long-term complications. Regular checkups allow healthcare providers to identify and address any late effects of treatment, such as heart problems, lung damage, or secondary cancers. Thirdly, follow-up care provides an opportunity for patients to discuss any concerns or questions they may have about their health and well-being. Section 10. Conclusion. Empowering future physicians. Hodgkin lymphoma is a complex disease with significant implications for patients' lives. As future physicians, MBBS students must possess a thorough understanding of this malignancy, from its underlying causes and risk factors to its clinical presentation, diagnosis and multifaceted treatment strategies. A comprehensive grasp of Hodgkin lymphoma is essential for providing optimal care. By understanding the potential long-term complications and the importance of follow-up care, MBBS students will be well equipped to guide their patients through the challenges of this disease and empower them to live full and healthy lives.